it gives me a great pleasure to introduce a very distinguished speaker at our conference, Dr.Mariam Baghdady. Dr.Mariam Baghdady is an assistant professor of oral and maxillofacial radiology at Kuwait University and at the University of Toronto. Dr. Baghdady completed her oral radiology residency, master's, and Ph.D. in medical education at the University of Toronto. She has completed an advanced medical education fellowship at the University of Toronto's Wilson Center for Research in Health Professions Education. Dr. Baghdady is a fellow of the Royal College of Dentists of Canada and a diplomate of the American Board of Oral and Maxillofacial Radiology. Dr. Baghdady currently serves on multiple educational and accreditation committees at Kuwait University Health Science Center. Dr. Baghdady was elected to be the dental representative for the accreditation committee at the Faculty of Medicine at Kuwait University and the working accreditation committee for Faculty of Dentistry at Kuwait University. She is also an assessor for the World Federation for Medical Education. Dr. Baghdady's area of research is the cognitive role of basic science knowledge in diagnostic reasoning. Very interesting. She is interested in international collaboration in the areas of faculty development and research in medical education. Today, she'll be sharing with us what I assume is a very, very interesting presentation on creating a niche in unexplored paths in dentistry, challenges and opportunities. Welcome on board, Dr. Mariam.
Thank you so much, Doctora, for this very kind introduction, and good evening, Gaza. I have to be honest, I am extremely privileged, honored, and thrilled to be part of this convention, and I'm really looking forward to speaking with all of you today. So what we're going to be talking about today is creating a niche in unexplored paths within dentistry. And we want to kind of talk about how we can do that, the challenges and the opportunities that go with it. So as you kind of heard from the introduction, I took an unexplored path or an untraditional path within dentistry, both in my clinical specialty and within my research area. So what we want to kind of do today is almost expand our horizons and think about what dentistry gives us as opportunities outside the traditional areas of dentistry. So let's start out and think about what are the traditional areas of dentistry. So typically a dental student will graduate from dentistry and go into general practice. Apparently 80% of dental students end up in general practice, which is a great way to have a career within dentistry. Another 20% of dentists will go into more traditional subspecialties of dentistry like orthodontics, prosthodontics, pedodontics, endodontics, and oral surgery. And most dentists as well will end up in careers that involve either private practice dentistry, or they'll end up in a government practice, which is more of a polyclinic sort of environment within the Ministry of Health or within the government sector. So what we want to do today is explore how we can expand our horizons with a dental degree and how we can sort of move away from some of this traditional paths, especially if you find that as a dental student right now, or as a junior dentist, that you're not feeling really fulfilled with sort of the traditional areas. So let's kind of go into these areas that are outside of the traditional path. So how do we do that? Or how can we move outside of traditional paths of dentistry? So the first place that we can explore is exploring a non-traditional clinical specialty. So as we said before, the clinical specialties that are traditionally there, we all know about them. But what are some of the non-traditional dental specialties that are actually recognized by the international community? Things like dental anesthesia, for instance. Dental anesthesia has been the latest dental specialty that's been approved by many of the North American and European societies and within the Arab world. Dental anesthesia involves conscious sedation, hospital work with regards to general anesthesia as a support specialty to some of the other specialties like oral surgery and anything that requires general anesthesia. The diagnostic sciences, which I'm part of as well, are one of these clinical specialties that we traditionally think of as basic sciences, but they do really have a clinical element to them that is crucial and at the heart of dentistry. like oral pathology, oral medicine, and oral maxillofacial radiology. These are very diagnostic areas, but they do really fit in the heart of dentistry. And there's so much work that can be done with all the other specialties and can be a very fulfilling area of clinical specialization. Public health is another area that can be explored with a dental degree. In public health, you're really not looking at as individual patients, but you're looking at the society or the community as your patient. And what we're looking at in public health degrees is looking at prevention, and mainly in prevention in societies and in treatment. So these are areas that can be explored with in terms of non-traditional dental specialties, which are very interesting and very needed within our societies because we don't have too many people filling these gaps. Something else somebody can do is actually go into some of these traditional clinical specialties that we spoke about earlier, but then create a niche for themselves within these clinical areas. So mainly following through with subspecialties and clinical fellowships. So let's give some examples. Craniofacial anomalies is something that can be very interesting within orthodontics or oral maxillofacial surgery, very much needed within our part of the world, especially with areas where there's a lot of interfamilial marriages. TMD and temporomandibular joint disorders and pain. This is a subspecialty that anyone within a specialty or in general practice can be taking. It's really focused on temporomandibular joint disorders and pain. And it's a very interesting topic and a subspecialty that is much needed within our area as well, within our geographic area. Dental oncology has been a clinical specialty that's been very common within the Far East society, so within Japan and China and Korea, something that we don't have much of here, but it's a very interesting area to be subspecialized in if you're interested in that kind of work. Maxillofacial prosthodontics is a prosthodontics that works within teams where they do more maxillofacial work and not only dental work. We've seen these specialists working within oncology teams to reconstruct patients after cancer treatments. Another way you can look at changing or creating a niche for yourself is going into a non-traditional path of research. So if you think about research in dentistry, we mainly focus on dental research. We focus on clinical research, but some non-traditional areas would be going into things like neuroscience and pain, which is a huge part of dentistry and one of the main symptoms we deal with on a day-to-day basis. Basic science research, I know we think about basic science research as something common, but it's actually not. So stem cell research is really on the rise within dentistry. Microbiological, there's a whole slew of basic sciences that somebody with a dental background can engage in. Biomedical engineering is a hot topic and a hot area in dentistry, to a point where there are some dental schools in big institutions where the head of the research institution is actually an engineer and not a dentist, especially when we look at biomedical engineering tools, materials, the stuff that we use in dentistry on a day-to-day basis. Again, somebody with a dental degree can go into these areas and really prosper in this type of research. Healthcare is professions education, which is my area of interest. There were only probably 2 dentists within the whole fellowship. And what we do is look at different areas: cognitive psychology, assessment, psychometrics, curriculum design, understanding clinical reasoning. There's so many different areas within healthcare as profession education that you could take and use within an academic or even within a ministerial job in the future. Again, public health, very important in our part of the world, looking at the statistics and needed within our societies and creating programs for prevention and treatment for our communities. So it's a very interesting area that is much needed in dentistry. Then we can think about other places as well that are non-traditional, which is an untraditional work career path. So again, as we said before, most dentists end up in private practice or in a government job or a government clinic or polyclinic. So where are things that you can kind of look into as a career other than those two? So academia, a lot of people think that academia seems a bit traditional for dentistry. It's actually not. Academia isn't a very attractive place for dentists because it's not as profitable and not as lucrative as other things like private practice. So academia is almost considered a non-traditional path for somebody with a dental degree. In academia, you're able to teach, do clinical work, and do a lot of research. Sometimes they call them a triple threat, where they have to kind of follow through different areas. Public health, again, I'm keep bringing that back. A work career in public health within ministries, putting down laws, regulations based on public health research is really important within our communities and within our societies. Hospital dentistry. Hospital dentistry is one of these things that we don't hear too much about, but even a general dentist can decide to have a career in hospital dentistry. So in hospital dentistry, you're looking at a dentist that takes care of inpatients. So for instance, patients that are within long-term care in the ICUs or long-term care within the hospitals. Any dental work that is needed within the wards. Usually these dentists are part of a medical team that work in a patient-centered care center, and you really play a very important role within this dental team. It's very common, especially in cancer centers. These dentists take care of patients before, during, and after radiation therapy and surgery and chemotherapy, especially for head and neck cancers. Dentists can also end up in industry. As we said before, biomedical engineering is a hot topic right now. Ending up in industry is a really lucrative and a great career path for dentists. Media. We are in the age of media right now. We've seen dentists that have sort of left the traditional career within dentistry and created a niche for themselves within media, whether that's patient education, advocacy, or any of these things, or within media in marketing for industry or in private clinic or for private clinics. So it's a new field that's coming out, but it's becoming very lucrative as well. NGOs. I can't stress more the importance of NGOs, nonprofit organizations, or nonprofit governmental organizations, especially in our part of the world, looking at different areas within the society that have less access to care, dentists working within these communities and working for advocating for dental health care within these communities, especially in refugee camps and some of the other areas that have less access to care. So it's a great career, and at the same time, it's a very fulfilling career. Another place that you can find yourself in is leadership, policy, and regulation within ministries of health or within academic institutions. Those are areas, especially if you have a public health background. Research institutions. Research institutions are an interesting area because if you kind of look at different countries or different areas, you'll find that there are research institutions that are focused on funding the type of research that come in through their organization, funding, granting, that kind of thing. And having a dentist or having somebody with a dental background is really important, especially if you have a research background, to be able to look at how these funds are distributed within academic institutions and within society, and how we do it. So you can end up in these research institutions. Again, a great career path to look into. The other way we can do non-traditional is non-traditional paths of continuing education. So postgraduate training in a different country isn't always very feasible. It's not always, not a lot of students want to do it. So many students will just finish their dental degree, especially women. They want to finish their dental degree and, that whole part is done. And of course it takes much longer time, but postgraduate training in a different country is considered to be a non-traditional path in some areas, but it will take you onto a career path that can be different than what you expected right after graduation and going right into general dentistry. Postgraduate training in a non-conventional program. So there's many non-conventional programs that can happen right now. Now with implant training, with AI, and with online learning, even within your own country, if you don't have the ability to leave where you are, there's many different types of training that are non-conventional, which is the typical residency program that you hear about. So these are all non-traditional paths that you can go forward with continuing your dental education. So right now we are sitting there and you're saying, well, I'm at a point right now where I actually do want to think about a career that's not traditional. So how do I start? How do I think about this? How do I organize this? How do I plan for this? So the questions that you want to ask yourself is, what do I like to do? That's the first thing you want to ask yourself. For myself, right after dentistry, I asked myself, do I like to do traditional dentistry? And I found out that I really didn't like it. So that's one of the things that you want to ask yourself. What is something that I really enjoyed while I was in dental school, for instance? What are the things that I like to do? The second thing you want to ask yourself is, what am I good at? So if you have great technical skills, then stick with that, especially if you like doing it. If you're somebody that's very good within your student bodies or your student societies, that you did a lot of leadership and created programs, then maybe you want to go into more of a leadership program. If you enjoyed research and you had the opportunity to do research and you think that that's the area, then take a research path, whether in academia or in industry. Then a really important thing that you need to think about is, where can I make a difference within my local community? So if you look around you and say, where are the areas that have gaps that I can sort of fill in? So for instance, in my case, I kind of looked around me and said, there are not a lot of people that are interested in diagnostic sciences. And I really like doing diagnostic sciences. I'm very interested in that area. So maybe that's an area or a gap that I can fill. If you look at your own community and see that we really don't have any public health, for instance, or we don't have representatives for industry, or we need more biomedical engineers, go for it. So these are areas where you want to see where you can actually fill a gap and you can be unique within that area. Now, while we think of all of these things, a very important point that you want to think about is, how can I do all the things I love, but at the same time be financially independent? Especially as women, we want to make sure that we're financially independent, and the career path that we're taking is, even if it might be a little bit difficult, but it's an area where I can support myself and I can support my family so that I can continue doing the work that I love to do. So I'm just going to go very quickly into my story of how I kind of created for myself. I went through the same steps and thought to myself, how can I take a non-traditional path in dentistry? So I graduated out of dentistry. This is me in King Abdulaziz University, way back when I was a young dentist. And I really thought to myself, I don't like, or I don't really enjoy technical dentistry. It's a great area, but I don't enjoy it myself. But at the same time, I really enjoyed patient interaction. I loved working with patients. I also found that I liked diagnostic sciences, and it was one of the most things that I enjoyed, and I was really, really good at it. I also love teaching my junior students, and I love to sort of understand how people learn. And when I looked around me, as I said before, I didn't see that there were many diagnostic practitioners. So all of these sort of questions took me to an area of more diagnostic sciences. And radiology, to me, had a lot more interaction with patients than something more like pathology, where you're kind of more in a lab than anything else. I had my eyes on oral radiology and at the same time oral medicine. But I ended up doing radiology because I also like physics very much, and I like the different interactions with different sciences. So what did I do? I spent my first few years after graduation sort of soul searching at the beginning. I graduated from King Abdulaziz University. I started working at the Ministry of Health, very traditional. And I kind of thought about, what am I going to do? And at that same time, I got married. So again, new factors to think about. So what happened at the time is I thought that, okay, I'm going to move towards more of diagnostic sciences. So the first thing I wanted to do is secure myself financially. So applied for a scholarship, was able to secure a scholarship to be able to move forward. And at the time, I also had my first child. New challenge, new juggling to go in. Did it deter me? It didn't deter me, but at the same time, I was very aware about the challenges going forward. I started my radiology program at the University of Toronto. And at the time I completed my residency and my master's in radiology. And I did a master's because I was interested in learning. I did a master's within medical education. I then moved towards doing a PhD because I was still interested in research and interested in academia. I was able to secure a scholarship as well to be able to do this because I couldn't do it on my own financially. Obviously, it's very difficult to do that on your own. My family was expanding. I had more children, and now the juggling became even harder. But it can be done with a good support system. I completed my fellowship and my medical education fellowship and my PhD. And then after that, came back to an academic position in Kuwait. So the beginning really was a lot of exploration and soul searching at the beginning. I didn't have a clear thing of what I wanted to do. And then it took me about 3 years to complete a residency. And then after that, it took me about 5 years to be able to finish a PhD. All that while sort of juggling family and children and young children. So as women, we always have these issues and these questions. Am I able to do these things all at the same time, especially doing a non-traditional career? It's doable, but as we say, there are challenges. There's challenges, and it's very good to be aware of these challenges before embarking on these on this kind of journey, and planning ahead for the challenges that are going to come. So one of the challenges, the journey is long and much longer than if you were to take a non-traditional path. But if you're ready for it, go for it. There will be financial barriers, especially if there aren't any scholarship or support. So before embarking on this, you want to sort of find your way of how you can support yourself and support your family. Applying to local scholarships, international scholarships, these are always important as you move forward. You may need to create your own opportunities when you're done and when you're back. It might not be the most profitable area, unfortunately. So private practice is one of those things that are much more profitable. And as we know, especially in our societies, social expectations and pressure. Oh my goodness, you finished. Now you have to get married. Now you have to have children. Now there's a lot of social pressures in there. You need to be aware of them and cognitively deal with these things, but at the same time, kind of pushing through what you want to do. And sometimes it can be a lonely path, especially if you're going in an area that not many people are in there. But having said that, even with these challenges, what I want to say is do what you love. You'll have more long-term job satisfaction. Profitability is not only about money, it's about job satisfaction. You'll be more productive and you'll have much more well-being. So if you find yourself in the middle of, you don't fit in either box, there are many different paths out there, and do what you love and try to find your niche. And the well-known poem of Robert Frost, two roads diverse in a wood, and I took the one less traveled, and that made all the difference. And I will tell you, I did take the path less traveled. It was very fulfilling, and I'm very happy in it. And I hope that you can do the same. So thank you very much for having me. And I'd be happy to answer any questions. And thank you again.